Welcome back to the Hour Invite podcast. My name is Nima.
My name is Aaron.
And today we're joined by a very special guest, Dr. Dain Rusk, the Vice President of Publix Pharmacy. Thank you so much for joining us.
My pleasure.
Thank you so much for being here, Dr. Rusk. Just for our viewers and listeners, can you just explain a little bit about your role at Publix?
My role at Publix is I am responsible for the pharmacy business unit at Publix Pharmacies today. So I oversee all of our pharmacy operations, all of our pharmacy administration, which would be inclusive of things like pharmacy procurement, pharmacy managed care, our pharmacy systems and new business. And then we have another facet of our pharmacy business here we call central pharmacy, which is we have a very large central fill pharmacy, very large central processing pharmacy. We also have a closed door compounding pharmacy and a closed door specialty pharmacy. So my role encompasses all of those businesses, but we're a pretty large pharmacy organization when it comes to all the different facets that we support in retail pharmacy.
So Publix currently has 13 in-hospital pharmacies in the state of Florida, with the most recent one that you guys just announced, Jupiter Medical Center. What has been the vision and goal of these collaborations with the hospitals?
So our goal with that is pretty straightforward. We want to help partner. Our goal is we want to partner with the health systems to create this access to care is the best way for me to describe it. So what we do in most of these cases is we go on site, put a Publix pharmacy with the intention of being able to provide discharge medications. We refer to that as meds to beds. So we have an on-site pharmacy where we can serve the hospital employees, but more importantly, being able to provide those medications upon discharge, because we know as patients leave a hospital with medications in hand, there's no delay in starting that therapy. It prevents rehospitalization. It really helps the hospital drive those metrics that they're looking to improve upon within things like HEDIS scores to prevent rehospitalization where they tend to lose reimbursement. From our standpoint, it helps us ensure that that patient is really having continuity of care is what I would call it. So they're getting their medications upon leaving. Oftentimes they're new patients that may not have been at Publix pharmacy in the past. So we're able to make that connection and provide them a new alternative if their insurance plan allows it and if they're interested. So that's the way we look at it. It's really partnering with premier health systems within our different markets so that we can really provide that continuity of care. We also cross over with the health system and allow them to put a telehealth inside of our pharmacies, adjacent to our pharmacies. And we know that's very important too, is again, the recurring theme is access to care, improving access to care for patients, ensuring that they have continuity of care when they're leaving the hospital. Those have been the real driving forces for that. And you're right, we do have 13 of those relationships today. In another week, we'll announce a 14th, and we have several others probably before the end of the year. So these are very important relationships to us.
You touch a lot on continuity of care. So what are some of the other innovative things Publix Pharmacy is currently working on that you're excited to bring to the community and customers?
So there's some of the things that we're working on that are what I'll call public knowledge. Obviously, some of the things we're working on, I'm not ready to put out there in front of people just yet, but let me talk about some of the things that we have been working on, things that we're enhancing. Something that's very, very important to us is leveraging technology, because we think it's really important to use technology in ways that empowers our pharmacy teams and really allows our pharmacists to be more customer facing. So I talked about central fill. We have a state-of-the-art central fill facility. In fact, it's probably one of the largest in the United States when it comes to retail pharmacy as a single entity. So we have a very large central fill pharmacy where we also do central processing. So some of the things that we've really tried to do is take a lot of the production work out of the pharmacy. And as you probably know yourself, your viewers who work in retail pharmacy, it can be very busy. It can be very challenging with the help and the hours that are afforded in the models that exist. What we try to do is leverage technology and utilizing that by pulling production out so the pharmacist can be more customer facing. That's kind of what we're doing from that standpoint. In terms of other things that we've looked at or things that are in place, when I talk about technology, we know consumers, patients in this case, are really moving to be more digitally engaged, more online. So some of the things that we've recently rolled out and that we're enhancing and making them even better is the ability to allow patients to, I'll use the term, shop how they want, when they want, and where they want. And what I mean by that is the ability to go on to a mobile app, refill your prescriptions, pay for those prescriptions, and then maybe you want to go to express checkout in our stores. We've created these express lanes where you can go to and just pick up your prescription and go. Or maybe you want to use real-time delivery, have a concierge service where it's being delivered to your home or your place of work. That's something else that we've created, and we kind of accelerate that effort during COVID. Or maybe it's a second-day home delivery to your home. So really trying to allow patients to have the opportunity to have their prescriptions, especially when you're dealing with things like pandemics where people are sheltering at home, the ability to have prescriptions, so I said, shop the way they want. The term I like to use is shop where they want, when they want, and how they want.
So innovation, like you said, is very important for Publix, and that's part of the expansion process. What are the future goals for the expansion process? We're right now in Southeast regions of Publix is in the major Southeast regions of the United States. Are the West Coast areas, in the future plans? I know your competitors, the CVS and the Walgreens, are obviously where you're competing against. Is that something you're looking to do?
So I'd say no, especially to the all the way to the other coast. We're currently in 7 states in the Southeast quadrant of the United States. And we've moved into each one of those states. Each time we've moved into one, it's been very strategic, it's been very deliberate, and it's about creating a scale and sort of a density within an area. I don't think what we're not interested in doing is going into a market where we don't really have name recognition, people don't know, and there's other competitors, especially on the West Coast, that have strong name recognition already that we would really be competing against that. I think our bread and butter, our secret sauce has really been to slow and steady as we move forward. We're as far north as Virginia right now. I can't say that we'll go any further north than that. I can't say that we will. I can't say that we won't. But at this point in time, the 7 states we're in, we'll continue to expand in those geographies where it makes sense. And I think we'll continue to kind of maintain that concentrated footprint in those 7 southeastern states.
So how do you think the current COVID-19 pandemic has affected your operations? And do you think some of the changes you've had made because of the pandemic will affect you in the future? And do you think that will be beneficial for Publix Pharmacy?
Yeah, so I mean, certainly COVID impacted businesses, all businesses pretty dramatically, and pharmacy was no exception to that. And kind of what I said when I said we became more digitally engaged. I think disruption is a natural thing that was going to happen with pharmacy. It's as people, when you talk about retail has really largely moved to an online presence. Amazon has made sure of that, and many have had to follow suit. I think really what COVID did for us is accelerated that timeline in terms of being able to provide customer solutions to shop online, to pay online, deliver online. But I think it's going to evolve from there. I think you're going to start to see things, and not to say there's not one-offs that exist like this today, but the idea of maybe more curbside delivery or locker pickups where people can go to, whether it be inside your store in a large grocery store like we are, or remote locations, maybe large downtown. I think you guys are down within the Miami area or maybe even Tampa. You've got large employer groups in downtown areas. The idea of having this pickup solution where people can fill their prescriptions or send them through their mobile app, but as upon leaving a big high-rise building downtown, they can stop by a locker solution in the lobby and actually pick up their prescription. So I think creating more convenience is what people are looking for. But I'd also say COVID really has shown how important the pharmacist is as a healthcare provider, being able to do things like testing for COVID, being able to provide preventative immunizations, and COVID will be a very important one that's coming. We've certainly seen how the Department of Health and Human Services has lowered the age for pharmacists to provide. In some states it was already lower, but here in Florida that wasn't the case. But I think more importantly, COVID has really shown the value that the pharmacist brings as being that primary healthcare provider, the access. We started by talking about creating better access. Well, I think the one thing that we know for sure is there's no greater access to a healthcare provider than a pharmacist. So I think COVID has really highlighted that, and we'll continue to try to accelerate those efforts where we make the pharmacist front and center, customer facing, leveraging technology to make sure the customer is customer facing.
So as you know, we're in flu season right now and talking about immunizations and the age being lower. I'm just going to assume that a lot of more, the flu season is going to be hectic. Now, we were talking about COVID. Let's say the COVID vaccine comes in. it's going to be a lot more hectic on top of the flu season. Have you guys prepared for that? Thought about that? What's the plan going ahead if the vaccine was to come in the middle of the flu season?
We have, and we anticipated just the flu season alone was going to be hectic, just because people's awareness was really awoken here, is what I would say. You probably have a large portion of the population. If you look at the United States as a whole, only 50% actually get the flu vaccine on any given flu season. But I think a lot of people became much more aware and much more understanding that gaining preventive immunizations and gaining herd immunity is very, very important. So in anticipation of just how that was going to be for the flu season, even before the COVID vaccine came, it was really important for us to look at things of how we could really allow for social distancing and really proper procedures to do that, ensuring that we had personal protective equipment, ensuring that our patients felt like they were in a safe environment. How could we do that? We tried to do things. We were, again, leveraging technology, wanting to create more contactless environments where patients today, they can still come in with no appointment necessary, but we also wanted to create the experience where they could go online and schedule an appointment so that they knew that time would be available for them when they came in. We wanted them to have the ability to fill out the medication, the vaccine administration form online, be able to sign for it digitally. So we really recognized areas, what I'd call friction points for our pharmacy teams and for patients, how we could try to alleviate them, understanding there was going to be greater volumes coming in. We know it was going to start with flu season and providing those flu vaccines, and we're certain it's going to just parlay right into the COVID vaccine becoming available. And thinking outside the box, creating these, call them outdoor events, where we can create these flu clinics where not inviting, especially when you think of COVID, you don't want to invite people or presumptive positive patients into a store that has large populations in there shopping and even working. So kind of creating these pop-up tents and these environments where patients still feel safe, still feels clinical, because you have the healthcare practitioners there doing the testing, providing the immunizations. So again, trying to think outside the box as well.
I have
Go
a
ahead,
good
Nima.
question. So I work for Publix Pharmacy, and Aaron has also interned at Publix Pharmacy for our IPPE rotations. And why do you think whenever we wanted to pick, where we wanted to work or where we wanted to go to IPPEs, Publix was always at the top of the line. Everyone talked so highly of it when compared to the other community settings. For working wise as pharmacists have always been like, Publix over everyone else. What do you think you guys have done over the years to be able to win that trust of your employees and people that are not your employees that want to get into Publix?
So that's an easy one for me. I think it goes back to our founder, George Jenkins, very fondly referred to as Mr. George here. One of the things that Mr. George did many, many years ago when he started the company, in fact, we just celebrated our 90th birthday over the weekend, so 90 years that Publix has been around. One of the things that Mr. George did was he gave the company back to the employees. And what I would say to you is, why do I think Publix is an employer of choice? Why do I think we have some of the best employees? Why do we have some of the lowest turnover? Because when you own something, you take a little bit better care of it. And frankly, what we have is a group of employees, and it goes to the pharmacists, it goes to the technicians, it goes to everyone who works in our grocery store, whether it be in the stores or in our distribution channels or in our offices. And that is, we have a group of people who think like customers, but act like owners. And when you operate that way, it comes through loud and clear. It's kind of like the idea when you say people are wearing masks right now, you can't tell if someone's smiling, but sometimes you really can. I would tell you that's the one thing about Publix associates is they generally love their job. And when you love your job and you take care of the place that you work for, it comes across very special to the customers. And this is why, because customers feel like they're being taken care of very special. And when they refer to Publix, they use terms of endearment that you don't often hear, especially about a grocery chain. They talk about how they love their Publix. And they often use the terms, my Publix. That's their store as far as they're concerned.
Yeah.
And the employees that work there will tell you firsthand, it is their store. They own it. So I'd go back and leave it at very simple and say, when you own something, you take a little bit better care of it. It's the difference of you lease an apartment versus you own a house. I promise you the care and effort you put into the house that you just purchased versus the apartment that you're leasing, they're two different feelings. And when you can kind of differentiate between that, you kind of see the love you have for your home that you've purchased versus I kind of like my apartment that I lease. It's the best way I can describe it.
That's perfect.
So in the state of economy, obviously, a lot of people are unemployed, don't have jobs, and the healthcare cost is rising. So how important is it for you and your team to be able to provide these services, free medication or reduced costs? Because I feel like that is something that everybody can benefit greatly from. So can you just explain that a little bit?
Sure. And I think that's a big staple for us here at Publix. It kind of goes back to what I said in the beginning. The common theme here, it's about access to care. It's about continuity to care. And when you can have value-add programs that provide access to patients who otherwise may have gone without because they couldn't afford, even when people have insurance, nowadays insurance plans designs have co-insurance, deductibles. Oftentimes people will go without because they can't, or maybe they're on Medicare Part D and they've fallen into the donut hole. So when you have those variables like that, it inhibits access to care. This is what leads to people being rehospitalized. So we feel very strongly about our value add programs, I'll call them, like our free programs or our $7.50 90-day maintenance drug programs. We believe we've created some very meaningful value adds where we've taken cost out of the equation. We're allowing patients to get healthy and stay healthy. And we believe when we can do something like that, we create patients and customers for life. And that's so important to us.
So being Publix pharmacy, you're part of a grocery store and most of the revenue comes from the grocery store for the company. How has being part of a big chain grocery store impacted your business and your name as Publix pharmacy? And what are the positives and negatives in being with a grocery store?
So I think grocery pharmacy as a whole, not even just Publix, grocery pharmacy as a whole has come a long way. When I first got into pharmacy and grocery pharmacy 25, 26 years ago, the relevance didn't resonate all that well. People didn't, when they thought pharmacy, they wouldn't think of a supermarket pharmacy.
Yeah.
But at those times have dramatically changed. And what I would tell you is the advantages are this, very simple. In a grocery store, especially a grocery store like Publix that has a significant amount of daily and weekly shoppers in each store, when you have a base of customers 15, 20,000 deep per store every week, the opportunities are right there for you. You don't have to actually go out there and recruit customers to come into your store to get their prescriptions. Yeah. You've got a captive audience every single day. So that's a huge advantage when you think of it from that standpoint. I think the other advantage is for the overall part of the grocery store is pharmacy as a whole. Pharmacy customers, they're very sticky because people don't necessarily want to shop for healthcare. They trust their pharmacists. I mean, if you think about it, and you may have experienced it, I'm certain that your listeners probably have as well, people will move to a new community, a new home, but they may still very well travel back to their pharmacy. They will travel back to their doctor because healthcare is very personal. And once it's very personal, it's not something that you oftentimes want to take a chance or roll the dice on unless there's a reason you have to. Your insurance plan has forced that issue. So I think those pieces alone is really kind of what it's what makes it so unique. And healthcare is very personal.
So I think you kind of already answered this question, but I want to ask it. It's a crazy idea to put out there. Do you ever see Publix pharmacy opening up its own on the own location, just a Publix pharmacy by itself, or do you always see it being with the grocery store?
I think it'll stay with the grocery store because as I talked about earlier, is it's very sticky.
Yeah.
Is every time we convert a grocery customer to a pharmacy customer, we increase the amount of time that they're going to be within that store. Because when you think about it, people they plan out their grocery shopping trips once a week, bi-weekly. But pharmacy, you get sick, the kids get sick, the family gets sick, you have multiple medications that may or may not be synced. So the trips, the frequency, as I call it, comes more often. So the synergy of the two together works. But to say, will we ever have freestanding? I consider our hospital pharmacies freestanding. But in terms of, will we ever have a pharmacy on the corner, similar like a CVS or Walgreens? Probably not our exact business model. It's in part of a broader strategy. I can see it being maybe where we partner with one of our health systems and we create like a health hub, like we've seen with CVS or even Walmart has. I could see something like that, but I don't envision that we'll ever have freestanding public pharmacies because that doesn't fit the model or the synergy we're trying to create in our total store, which is we're trying to create the one-stop shop.
So fighting for the profession of pharmacy is something that we all do on a daily basis. So what is Publix Pharmacy doing to move the profession of pharmacy forward?
So that's something that's very near and dear to my heart, something that's very important to us. So we not only work with our trade group, NACDS, National Association of Chain Drugstores, but we also work with each one of our state boards of pharmacy, as well as from a federal lobbying standpoint. We are always trying to stay ahead and really educate not only from a federal standpoint, from a state standpoint, where how we can continue to have pharmacists, we like to use the term practicing at the top of their license. But there are some states out there that have done an amazing job. You may know this from your learnings and your teachings, but if not, I would really encourage yourself and your listeners to go look at a state like Idaho. Idaho has done a fantastic job allowing pharmacists to practice at the top of their license, from examples from technicians being able to give flu shots under the guidance of a pharmacist, pharmacists being able to prescribe things like birth control and statins for patients who are diabetic, they're not on a statin, pharmacists being able to do a lot of unique point of care testing. So I think these are the areas that we are fighting very hard here at Publix with all the states that we practice in, as well as from a federal standpoint, and employing tactics like using lobbyists, because we think it's really important to fight for the face of pharmacy and really talk about how important pharmacists are. I think COVID has accelerated those efforts for us in many of the areas where we may have been a little bit behind the curve. But I think COVID's going to help really position pharmacy, and more importantly, pharmacists to be able to practice at the top of their license. It's going to be kind of what I hope is the springboard to really start to show what the value that pharmacy brings.
Yeah, for sure. And Publix Pharmacy recently just received the award, the Patient Choice Award. And this was the first time you guys received this award. What do you think Publix has been able to do better than your competitors to win this award? I mean, competition has to be on your, at least some viewpoint when you come into the office. You guys are, in the end of the day, it is a business and you got to compete. So what do you think you guys have done better than the competition? And how do you view your competition?
So what do I think we've done better? I think we give great service. And the thing that you have to remember is not only in pharmacy, but in our store. And I can't separate them, because patients, consumers don't separate that. If they have a poor experience in the store, like the bakery, unfortunately, that also reflects on the pharmacy and becomes that negative experience. So what I'd say we've done better in our customers is across the board. We treat our patients, we treat our customers very special, and it reflects that way. It's kind of goes back to the conversation we had in the beginning, which is we're always able, and we have been able for a very, very long time, to hire the best of the best. We don't turn them over. We tend to be the employer of choice. And when you have the best of the best, they give the best service. And when you give the best service, people feel like they were treated very special, and they tell their friends, and their friends tell their friends. And as a result, it just kind of steamrolls. It becomes this little groundswell that turns into this small snowball that turns into this big, massive boulder rolling down the hill. And I think it's those variables that allow us to stand out with our customers. So when we won that Patient Choice Award, that was really special to us, because that was in the specialty space. That was specialty customers who have a very high touch. These are people who need prior authorizations, patients, copay assistance, foundational assistance. These are patients who are on high cost drugs that require a lot of touch, that some oftentimes just never make it to the final end because pharmacies or pharmacists just don't have the time, and they move past that. We have a very dedicated closed door specialty pharmacy in Orlando who spend a great deal of time. This is a special group who goes above and beyond. And I think our patients recognize that. I mean, what makes this award so special to us is this was voted on by patients, by customers. This wasn't people within the community. This wasn't people on the outside looking in. These are people who we've touched, who have come back and said that my experience was spectacular and rated us higher than all of our competition. So we're pretty excited about that.
So when you're talking, you alluded to hiring the best of the best. When you're looking for the different pharmacists, well, what are you specifically looking for? Like we both have interned, and Nima still is interning at Publix Pharmacy. Dr. Paul Keefe and Thomas Abram were great with me at Store 509. So what are you looking for when you hire these individuals?
I would tell you, and I can't speak for all the supervisors out there, but I feel confident that this is a consistent theme. We're looking for customer-oriented pharmacists who really have the ability to be self-starters. They don't need direction. They went to school and they want to come in there and take care of their customers. We love having interns because it gives us a real good dry run to see, and more importantly, mentor and teach them kind of our culture, the Publix way, I'll call it, which is we're looking for pharmacists who are about the patient, who are more focused on the patient versus the product. Now, that's not to say by any stretch of the imagination we're looking for you to cut corners and take chances and make errors fill in the prescription. No, that's not the case at all. We want pharmacists who don't view the patients as obstacles or as people get in the way. We want pharmacists that when the customer comes up, and even though there's a sign that says stand, wait here, they come up and interrupt the pharmacist and say, excuse me, I have a question for you. And the pharmacist looks up with a smile and says, how can I help you? That's really what we're looking for. We're looking for, more often than not, when we interview pharmacists or what I'll call pharmacy interns, students, graduate pharmacists, or even pharmacists who are looking to make a job change, more often than not, they tell us the reason they got into pharmacy is because they want to impact patients. They want to help their healthcare. They want to change their outcomes. Well, that's an easy thing to say, but we want to actually see that you live and breathe it. That's what we're looking for. We're looking for pharmacists who are looking to make a difference in a patient's lives, because when they focus on the patient, everything else takes care of itself, and it's what makes Publix stand out from everyone else. That's what we're looking for. We're looking for those types of pharmacists.
So you said you want pharmacists that focus on the patient. And I'm sure, as you know, a pharmacy, especially retail pharmacy, can get hectic. And, sometimes as a manager of a pharmacy or whatever, you're might be worried about your metrics. You're worried about here, what about here? There's multiple things you got to be worried about. Where do you think we have to go to kind of provide that opportunity for the pharmacist, not just Publix in general, retail pharmacy, so the pharmacists could practice at top of their license? Because in the end of the day, in reality, the retail pharmacy does get hectic at times, and maybe you won't be able to do whatever you might love to do it, but you just are not able to do it. You're short of staff, the hours are cut, you're working alone, and so on.
Well, and again, it goes back to something we said in the beginning, which is you have to be willing as a company to take chances and leverage innovation, because the more production you can take out, the average pharmacy, and this is no different in retail as a whole, the average pharmacy is going to be anywhere from a 60-40 to a 70-30 split, meaning 60% to 70% of your prescriptions you're filling daily are refills. The other 30-40% you're getting are the new prescriptions. Having the ability to work with those refills, especially maintenance ones, where you're providing solutions like medication synchronization, having the ability to synchronize these prescriptions, having processes where you're reaching out to patients proactively, letting them know refills are coming due. Do you want us to go get this ready for you? So that you can have the ability, like we do, to pull these prescriptions off-site, fill them remotely, bring them back into the pharmacy, already filled, processed, taken care of, so that the pharmacist and the pharmacy teams can focus on just new prescriptions and what I'll call clinical services, the idea of whether it be immunizations, whether it be medication therapy management, the things that will allow pharmacists to get paid for their license. But if you're not going to make those financial investments in these innovative technologies, then it really just ends up being words. It becomes very empty promises, because to your point, there's only so many hours in a day. And at the end, if all you can do is fill all the prescriptions that are in front of you, the ability to provide those clinical services, the ability to actually be customer facing and counsel or have that conversation with Mrs. Smith, who just wants a friendly ear to talk to, you're just not going to be able to do that. And what ends up happening in those cases is, more often than not, the pharmacists become very overworked and they become a little jaded. And it's not because they want to, it's because it's just what happens. You become You almost become a robotic machine, and that starts to show off to the customers. No longer are you approachable. No longer are you friendly. No longer does the customer even want to ask you, or that patient want to ask you a question about their health, because they can see it all over your face. They realize they're going to interrupt you and you're going to be a disruption. So the more we can leverage technology and those innovative processes to allow pharmacists to be more customer facing, as I've said, well, that is what's going to allow pharmacists to practice at the top of their license. It's the only way. Because if you don't take away all that production work, well, then really, only other answer is to add more labor into the equation. And with reimbursement rates being where they are, that becomes a challenge too.
So now, going off of what you're saying, piggybacking on that, the innovation and technology comes in. Now, a lot of people, we're in school, we always hear it. We just spoke to Dr. DePero interview, and we always hear the retail pharmacy is so saturated job-wise. So that when the innovations and technologies come in, how are you looking at it? Is it taking away jobs, or is it going to be able to keep that pharmacist job in there for us to be able to, have a job when we graduate?
So I look at it as it's going to create jobs. And the reason I say that is because, as I said, and without getting into great detail, reimbursement on prescriptions, the maintenance drugs, it's not getting better, it continues to get worse. And then you have a lot of these other things like DIR fees and all that come into play. So that part continues to erode profitability. So what we have to figure out is how we're going to improve profitability. And the way that happens is through these clinical services. It is providing more immunizations. It is providing point of care testing. It is being able to provide medication outcomes, different clinical interventions where you can be paid for that. And the only way to actually drive more of that activity is by freeing up that backside. So the way I look at it is this: no, that's not taking away pharmacists' jobs. That's allowing them to actually do the things we want them to actually do. We want them to get paid for what's in their head and not for what they can do with their hands. I'm just being honest with you. Anyone can count pills. Anyone can put them in a bottle. Unfortunately, no matter who counts them, it's the same reimbursement. The difference, though, is if I can stop you from counting those pills and have you more front and center and being able to provide those clinical interventions, being able to provide those point of care testings, being able to provide those preventative immunizations and get you paid for what's in your head versus what you're doing with your hands, well, then we all win.
Exactly. So you alluded to earlier about lobbying and advocacy for the profession. What are some things in legislation that you would like to see change or pass for the field of pharmacy?
I would like to see, there's a few things I'd like to see pass. I'd like to see more uniformity in how different states look at certified technicians and not handcuffing the pharmacist in terms of, well, they can only supervise two technicians to one. I think there's greater opportunities. I think Florida's done a fantastic job with that and recognizing that certified technicians under the supervision of a registered pharmacist can do a lot more. I'd like to see certified technicians be able to do more in terms of that. There are states out there that have done programs called Tech Check Tech, which is where the technician is checking prescriptions to help the pharmacist. Again, the concepts here are about freeing up the pharmacist to do those services that are going to pay much better than what some of these reimbursements are. So allowing technicians to give immunizations, like I said, in Idaho. Idaho is a perfect model out there to see. Allowing pharmacists to do clinical interventions when it comes, under protocols, but the idea of being able to prescribe birth control, the idea of being able to prescribe statins, especially to diabetic patients who are not on one. I think there are a lot of opportunities out there where we're handcuffing pharmacies, but more importantly, what I'd like to see is more uniformity. We have certain states out there that have done a great job and other states where they've really put the handcuffs on. And I think it's unfortunate because the idea is the boards of pharmacy are supposed to be helping provide better patient care. But oftentimes, I don't know that that's actually the case. It's because you're starting to see some of these regulations, they lead to certain pharmacies having to actually close down and sell their business because they're handcuffed. So a lot of things that we're lobbying for is what we think is for better access to care for patients by allowing us to leverage some of our technicians that are certified and allowing our pharmacists, again, to do things that we know that we've seen in other states that improve outcomes, really drive better clinical interventions. And that's really the things that we're looking at.
So one of the reasons that myself and Aaron started this platform was because we felt like the people that are higher ups at companies like yourself and the CEOs, vice president, et cetera, we don't hear enough from them. And we wanted to do this so you guys can send a message out. So I want to give this time right now. I want to ask you, what message do you have to all your pharmacists right now? If they were all in the Zoom call right now, what would be your message to them?
So I think, pharmacy over the past several years has gotten a bad rap. And what I mean by that is we're kind of hung up in that, well, pharmacy is this, it's a retail pharmacy, maybe is a better way to say, is this dying breed. Reimbursements are going down, innovation's driving that. And I would tell you it's just the opposite. I think pharmacy is going through a dynamic change. We're about to penetrate into new areas that in the past, maybe some pharmacies were successful in getting there and others were not. But I think leveraging pharmacists and what they know and being able to provide these clinical services. And again, I use that term broadly, but it is broadly. It's the idea of doing influenza testing, the idea of giving certain preventative immunizations, point of care testing, maybe taking someone's A1C and developing some care plans from there. I think pharmacy is about to really explode. I think COVID was the accelerant to help recognize what pharmacists can do and what they will be able to do. In fact, there is, if not for retail pharmacy, we would not have the amount of COVID testing going on across the United States today as we have. We wouldn't have the ability to do the contact tracing that we're doing. Yep. Departments of health would be overwhelmed. Every time pharmacy has been at the forefront, being able to step up and be able to show, here's what pharmacists can do. Here's what our education has empowered us to be able to help you do. So I would tell you that I think pharmacy is about to move into a whole new echelon. And as I said, I like to use the word, I think COVID's been the accelerant. It's allowed us to move pharmacy forward. That's not to say there's not fights to still be had. They'll continue to be there. Yeah. There are organizations out there that feel pharmacy is practicing medicine. And I don't think that's the case at all. I think there's the ability to have multiple practitioners out there that are able to provide quality care so that we can help, as I said, patients get healthy and stay healthy. So, I applaud you, gentlemen, for having a platform like this. I'm certain it's probably not easy to get to executives at different levels. Your commitment to Publix was one of the reasons why I wanted to come forward and help you with this platform. And hopefully, if I share this with my network, you'll get some other opportunities to touch on some other folks as well. I think it's important for people to hear different points of perspective too. Yeah. I think too often, I would say, we hear the negative side of things. We don't always hear the positive side, or we don't hear what's invisible behind the scenes. I think it's important to understand, I think the perception may be at store level that corporately everyone's asleep at the wheel. And I can tell you wholeheartedly, that's just not the case. I'm a pharmacist. 90% of my team in what I will say who make the executive decisions here are pharmacists. They've walked a mile in your shoes as a student, as an intern, as a pharmacist, as a pharmacy manager, as supervisors along the way. So I think it's important for people to understand that their voice matters, and it's sharing it upwards so that we can understand it. Oftentimes we're working on these solutions. We probably can do much better jobs from corporate, these ivory towers, as people like to refer to them, disseminating information down that says, we hear you, we're working on this. It may not be coming as fast as we'd like, but these are the things that we're doing, or these are the reasons we're not doing certain things. That's important for people to understand the reasons why we can't do certain things too. So I think your platform is a great thing. You should keep it up.
I think what you just alluded to, that you have all these pharmacists that are with you up top. I think that's what really separates your Publix company from the other your competitors, is that you guys, the people in charge, are pharmacists. So you guys know what's going on. You guys have been through the process. You guys have been in those stores. So you know what to expect and you know where to go to better for the profession. So you guys are doing a great job.
Good. And we're trying. And we're certainly learning along the way. And I think it's very important for us and our team. COVID kind of slowed it down a little bit, but one of the things that's very important for us is traveling out into our stores, having our team here who works in corporate as well as in some of our remote locations, spending what we call working days in our stores, experiential days we like to call them, because we don't ever want it to get too far removed and forget what's going on. Oftentimes we make decisions that make a lot of sense on paper, but they're not practical. And unless you actually get out there and see it, feel it, and touch it, you don't realize that the decision that you made is actually impacting business, not helping it. And good corporate soldiers, the folks in the field, more often than not don't want to complain. They just adapt because they were told this is what we need to do. Now, some people will voice that up, and that's great. And we hear about that and we try to react to it. But I think it's just as important for us as corporate employees to not lose touch with what reality is. And that means getting out there and traveling stores, working in stores. That's been important. COVID allowed me to get back in the stores a couple times and work and open my eyes to a few things that otherwise may not have ever bubbled up. But it's so important to stay connected to your roots.
For sure.
Yeah, I was about to touch on that. So how important is it for you to not become jaded in your role and what you're doing on a daily basis? How do you make sure that does not happen?
So easier said than done in terms of how do I make sure it doesn't happen. And what I'll tell you about that is I strongly encourage our team to challenge the status quo. I strongly encourage our team to disagree. We can all agree to disagree and we can all get a line before we leave the room. But what I don't encourage and what I strongly encourage us to do is challenge each other. Fight fair, but fight. Disagree with each other in the room just because I made a statement, or, Katie Petty, who heads up our pharmacy administration, makes a statement, or Kathy Leonard, who heads up all of our pharmacy operations across the chain, makes a statement. Doesn't mean that we all just agree and say that was the right thing. I'd like to hear dissenting opinions too. I'd like to understand counterpoints because, frankly, that is what has allowed Publix Pharmacy to grow. We have strategic meetings quarterly where we get into a room with all the key decision makers as well as some folks from the field, and we challenge each other. We agree to disagree. We also have something called the Pharmacy Advocacy Team, and that consists of each division pharmacists who are on that team who provide us feedback from their colleagues and their peers saying, this is what we don't like, or this is what we think isn't working, or here's something we do like. And we provide them feedback as to things that we're going to take as takeaways, things that we're working on, or why we can't change something that they otherwise think is not a smart decision. And then we encourage them, empower them to go take that back out to their teams. So we want to make sure that our pharmacy teams feel that there is a avenue to safely express comments that will not allow them. It basically allows all of our pharmacy teams to confidently and confidentially provide feedback to their advocate within their area, knowing that they're going to be protected. We don't know who that came from. There's no name tied to it. There's no store tied to it, but it's real. It's pain points. It's something that's causing a problem out there, and we want to know.
So when we interviewed Dr. Kathy Leonard and we put out the episode, I know a lot of pharmacists across the nation watched that one. And I'm sure there's going to be a lot more that are going to watch this one. I know my manager, Dr. Jean Faunes at Store 279, is going to watch this. And I want you to give a message to the pharmacists and the students that would love to one day be in your position. What is your advice to them to get to where you are at? And do you have any advice?
Yeah, my greatest advice would be two things. One, you have to advocate for yourself. And what I mean by that is don't assume that your district manager, your supervisor, your manager knows exactly what your desires are. You have to reinforce them, if not, twice a year, at least yearly on your evaluation. And that is, I have aspirations and desires to be a supervisor, to be a director of this area. What strategies do you suggest I take? You have to advocate for yourself. You need to let those people that you report into know so that you can make it on the radar, for one. And two, you have to be very willing to step outside your comfort zone. And that comfort zone sometimes is very difficult to want to take that leap of faith. And then I would also tell you, I'd be lying to you if I said it differently. You have to be lucky. You have to be in the right place at the right time. Mm-hmm. And you have to be willing to potentially be flexible. That may mean relocating in some cases. That may not always be the case. but that might be that. But I would tell you, and I say you have to be lucky, but I also think good people create their own luck. And the way you do that is not only by working hard, but by advocating for yourself and learning from picking good mentors who are going to help you along the way and not hold you back. Great mentors are people who are willing to give you what's in their head and teach you the right way and be perfectly content and frankly celebrate with you when you get promoted even above them, because they're really content with what they're doing. What you don't want are people who are going to hold you back, and you've got to be able to recognize those people pretty quickly. So advocating for yourself for one, really being very comfortable in wanting to step outside your comfort zone, knowing you're going to make mistakes, but fail forward, as I like to call it. And then finding really good mentors that can help you bridge those gaps of, call it knowledge gaps.
That was awesome.
So you talk about taking a leap of faith. Sometimes the leap doesn't work out. So what is some of the hardest decisions that you've had to make in your professional career?
Most difficult decision I've ever had to make, in all honesty. And frankly, I'll say this first, the best decision I've ever made too, but it was the most difficult. I'm not someone who's been with Publix my whole life. I started with Publix in June of 2018. There was an opportunity to come. Prior to that, I was the group vice president, head of pharmacy operations at the Albertsons companies, and I was in Boise, Idaho. I was not looking, nor did I even have knowledge that Publix had an opportunity to come run pharmacy. And they were using an executive search firm. They'd reached out to me, and frankly, it was not something that I think I was all that interested in, because I was really happy and all in and motivated where I was at. But the more I listened and the more I researched and learned about Publix, it was something that I became very, very interested in. And I had to take a huge leap of faith. And I had to go against everything inside me that said, I'm in a really great place. I have a great team. I'm very comfortable. And but I had some things in my personal life that were different. I mean, I was living in Boise, Idaho. My family was living on the East Coast. I was flying back and forth. So I had a lot of, as I talked about, taking some outside your comfort zone, doing some things, being flexible. This was an opportunity to bring my whole family together. But by far, the most difficult decision I ever had to make was making that leap of faith to come to Publix, and by far the best decision I've ever made.
So in our first interview, we sat down with the director of pharmacy at Cleveland Clinic, Florida, Dr. Kernan, and he said he has a bias for yes. How important do you think is that statement, having a bias for yes?
I think I'll probably disagree on that one, and I'll disagree with that in one way. I think having a bias for yes for your own personal career and development is an absolute must. But having a bias for yes, just because for saying it goes back to what I said before, which is I think you have to have the confidence to say no, especially when you're trying to change the status quo and you're trying to move things forward. Because I think when you have a bias for yes, you will always agree with those in power, those people you report into, those people above you. When you don't have the confidence to say no or challenge the status quo, what ends up happening is you kind of get into this routine of where everything's great. And what happens is when you have this massive accelerant like COVID come along, or you have this disruption that you weren't prepared for, unfortunately, the people who are always just saying yes and following along, they're going to very, very quickly be struggling to figure out how to adapt and catch up. So I think having a bias for yes for your own personal development is a must. But having the confidence to say no to the people you report into and the leadership above you, because if all you're going to do is shake your head and agree, then everyone's just going to constantly keep doing the same thing. And what ends up happening is you miss change along the way.
So if you can do anything differently in your professional career, what would it be, if any?
That's a loaded question, and it's probably not an easy question to answer. I'd probably have to say I probably wouldn't do anything different, because frankly, anything I would have done different may not have ended up bringing me to where I am today. And I'm in my personal opinion, in my best professional space that I've ever been in my career. And I probably would have said it to you each time along the way. It's not until you make those changes or you take those leaps of faith to say that you didn't realize that you could have even done better. or you're in a better place from personal development, your own professional development, personal experience. So I don't know that I would do anything different, because I'd also tell you that even if I told you some of the mistakes I made, I wish I did them different, I'd probably be lying, because those mistakes also helped me grow and they allowed me to do something different the next time. So maybe that's a cop-out, I don't know, but I don't know that I'd do anything different, because I don't think I'd be the person I am today had I did anything different.
Understand.
That's true. So I want to end it on a fun question.
Sure.
We went back to high school, undergrad, even pharmacy school, and we were to speak to your best buddy or your professors, and we're like, who was Dr. Dain Rusk? What would they say?
Wow, they'd be laughing if they heard that I'm well off today, because I was the athlete, outgoing, had to be the face in the crowd, so I was the one who was getting in trouble. I joke about it often. I'm fortunate and thankful that social media didn't exist when I was growing up. And I would just leave it at that.
Okay, perfect. So we want to thank you so much for taking the time to sit down with us. I know you're very busy, especially now with COVID. I can imagine how much more workload you have on your plate. So we want to thank you so much for joining us.
I'm happy to take time to interact with you guys, and certainly as you continue to build your viewership and your base, we should find a cadence to touch base, and maybe it's every 6 months or something like that. But happy to help out. Maybe there's more relevant topics 6 months from now we talk about, not so much reinventing the wheel we just discussed. But I think what you guys are doing is an important message. And as you can get more experiential content folks on your platform, you're just going to help it grow. So keep doing what you're doing, guys. It's a great thing.
This is the beginning of it all. This is just the first episode of many more to come. This is the foundation, so people know who Dr. Dain Rusk is. So more to come. I want to thank everyone that tuned in today. My name is Nima.
My name is Aaron.
And thank you for accepting our invite.